welcome back to this channel. This is Modern Journey with Esther, and I'm glad to see you all again. I hope you've been enjoying the videos I'm dropping on this channel. If you have any question, don't forget to drop that at the comment section. I will surely attend to them. If you are seeing me for the first time, you're welcome to this channel. Yeah, please consider subscribing. Don't forget to give this video a thumbs up. Don't forget to drop your comment at the comment section down there, and I will surely attend to them ASAP. So today we'll be talking about ways in which you can reduce breast engorgement, or better still, how to suppress lactation. That is what I'll be talking on today. Natural method. I've tried it. It's worked perfectly. It doesn't have a side effect. You don't need to use analgesic, and you don't need to stress yourself. You can also enjoy it with your daily activities, which is a natural method. It is using cabbage. How does cabbage dry up breast milk? Firstly, it must be a frozen or a chilled cabbage. This unusual form of therapy is effective because the cabbage leaf absorbs some of the fluid from the glands within the breast area, reducing the fullness in the tissue. Is cabbage good to stop breastfeeding? Yes, it is. Many moms see some reduction in engorgement within 12 hours of starting it, so it is very good and effective. Does cabbage leaf stop milk production? Yes, it does. Cabbage is a great natural remedy for several breastfeeding problems. It can be used to relieve engorgement and mastitis, or if you are weaning, it helps to reduce your milk supply. While the use of cold compress or cold cabbage leaf does help to lessen breast swelling and engorgement, it can also lower your breast milk supply. So the last on my list for today, which is the number 10, is cabbage. This is so perfect. I mean, it's working so perfectly. You don't need to use analgesic. You don't need to use any other thing when using this cabbage. This cabbage works so effectively. So how do you use this cabbage? And it can dry up the breast within 3 days. Either it is lesser than 3 days or it is more than 3 days, depending on your body system, right? I know you get that. So how do you use cabbage? Let's get into that. You just take, depending on the size of your breast, you get a bigger cabbage or you get a smaller size cabbage, depending on the size of your breast. You open the peel one after the other. You can open the peel, like the first, the new fresh peel up here. You open it, then you put it into a refrigerator. You can put it into a nylon, you can put it into a rubber, put it into your fridge and ice it. When it is cold, pretty chilled, to pad your breast. I'll drop a picture right here to see how you're going to pad your breast with cabbage. Cold cabbage leaf on the breast is helpful for reducing the pain and breast inflammation that may occur during breastfeeding. Breast engorgement and overabundant supply of breast milk or weaning a baby from breastfeeding can cause discomfort. We all know that. So cabbage leaf is encouraged to use to relieve pain and engorgement. How to use cabbage leaf? How to use cabbage leaf on breast. Researchers have found that cabbage leaf has properties that can reduce pain and swelling. Step-by-step guide. Cold cabbage leaf as smoothing. Here is how to use cabbage leaf to relieve pain when your breasts are sore from engorgement. 1. Before you use cabbage leaf for engorged breast, you want them to be cold, so place them in a refrigerator. 2. You can use green or red cabbage, but red is more likely to leave stain on your or discoloration behind on your nursing bra and breastfeeding clothing. 3. Once the head of the cabbage is chilled, remove it from the refrigerator, peel off the outer layer of the leaf and throw them away. Then pull off 2 of the inner leaves and place the head of the cabbage back into the refrigerator so it will be ready for the next time you need it. 4. In the sink, use cold water to rinse off 2 leaves you have removed. You want to be sure that they are clean from dirt, pesticides, and residents. 5. Reduce excessive water from the leaf by gently patting with a clean towel. You want to keep it as a piece with a slit down the middle. Once you remove the stem and cut the slits, the leaf will be able to fit nicely over your breast without covering your nipple. Also, you can cover your nipple. There's no harm in that. After you rinse the leaf, carefully cut out the stem from the center of each leaf without cutting it into 2. 7. Next, place the clean, cold cabbage leaf on your breast. Wipe each breast around each breast, but leave your nipple exposed. By keeping the cabbage off your nipple, the skin surrounding it will be dry and intact. 8. Hold the cabbage leaf in place on your breast the same way you would hold a cold compress. Or you wear a bra to keep the leaf in place for you. If you are worried about leaking, put a clean, dry breast pad over your nipple or on the top of the cabbage leaf to soak up breast milk. 9. You can leave the cabbage leaf on your breast for approximately 20 minutes or while they become warm, then remove them from your breast. Throw away withered leaf and use fresh ones next time. Repeat this process until you begin to get some relief and feel better. 10. Repeat this process until you get some relief and you feel better. For tips for using cabbage leaf, if you are still breastfeeding or pumping for your baby and just want to use cabbage leaf to help decrease breast swelling and relieve breast engorgement, be careful not to overdo it. Once you notice your breasts are feeling better and the swelling has gone down, stop using cabbage on your breast. This is a pictorial explanation of the number 1 to 10 how to use cabbage leaf. It doesn't have to really be perfect. The main thing is it should be a cold or a chilled cabbage. You need to just put it at your nipple side, covering your nipple and the other part of your areola, the darkened part of your breast. Put it, then wear your well-fitted bra. Voila, you are good to go. Use that when you are at home. You can change it like 3 times in a day, 1 throughout the night, or when you wake up to pee, you can also change it, but make sure it is chilled. And this is going to work magically on your breast. Firstly, it stops breast engorgement. 2, it helps to dry up breast milk. You don't feel pain. This has worked perfectly for few persons I've known. It has also worked perfectly for me because I've tried it and it's worked perfectly. Within 2 days plus, I'm cool to go. Some use it for 3 days, and depending on your body and the amount of breast milk you are producing, cabbage is so essential for you. Another thing is, you don't only use it when you want to stop breastfeeding. Also, when at the onset of when you at the early stage of postpartum, like you just gave birth and you are having breast engorgement and your baby is not taking up to what you should, like the breast is producing more than what the baby can take. Apart from you expressing few part of it into a bottle, maybe some are overstaying. When you are producing excessively, you just need to use this to prevent engorgement and you are good to go. You might want to ask, how long does it take for each method to work? That depends on individual body system. Like I used to say, it might take few days for some persons, it might take weeks, and it might take months for some people, but all you need is to make sure that you stick to the whatever you want to do or whatever thing you have decided to do from those points I've mentioned. Let me quickly drop this. When to seek medical attention when you are trying to wean off medical attention when you experience when you are trying to stop or suppress lactation. 1, if you feel uncontrollable pain and excessive breast tenderness, if there's redness around your breast, your areola or your nipple, if it is warm or feeling a little bit hot, you also need to go check your doctor. If you have generalized malaise, what I mean by malaise is generalized body pain, you also need to see your doctor or your health practitioners. And lastly, if you're having pain in your breast, which might be caused by engorgement or some other things, you need to ask or check on your health practitioners. No worry about this. Oral antibiotics can help to reduce engorgement or prevent infection or discontinue the work adverse effects, or helps to fight. Antibiotics can help to fight against infection and some other things that might cause those symptoms you need to check, go to the hospital for. So all drugs you will be needing or you want to use should be prescribed by an health practitioner. Don't take over-the-counter drugs that are not prescribed, because it might be adverse for you, because it might have a bad effect on you and your baby. So I hope you've learned one or two things from this video today. If you have, give this video a big thumbs up. Don't forget to subscribe if you are yet to subscribe to this channel. And it's a wrap on today's video. Thank you all for watching. Thank you all for listening. Thank you for your comments. Thank you for your thumbs up. Send me well to your family. Ciao.